So, you think you might have sciatica? What does that term even mean? In this video, we'll answer those questions, go over what's causing it, and share how to get rid of your pain. Almost everyone has had lower back pain at one time or another. Some of you may have even felt that pain shooting into the hip, buttock, and down the back of the leg like a lightning bolt. This is the hallmark symptom of the dreaded sciatica. But what exactly is happening here? How can we determine if your symptoms are truly sciatica or something else entirely? We'll start with some basic anatomy. But before we do that, please consider liking the video and clicking the subscribe button. This supports the channel and helps people find this information. The word sciatica basically tells us nothing, except that there's something going on with the sciatic nerve. Fun fact, the sciatic nerve is the largest and longest nerve in our body. It spans from the lower segments of our lumbar spine, segments L4 and 5, all the way down to our feet and toes, and it can be up to 2 centimeters thick. That's close to an inch for us Americans. For reference, most large nerves are more like the size of angel hair pasta, whereas the sciatic nerve looks more like a Sharpie marker. This is a huge difference. The sciatic nerve receives input from the nerve roots exiting the spine. These combine to form one big nerve that, like a river, forces its way through the back part of the hip and thigh. This provides sensation to the lower leg and supplies other leg muscles as well. Let's take an adventure along the path of the sciatic nerve. There are a few notable landmarks to check out. First is the piriformis muscle. It often plays the scapegoat when it comes to sciatica, but as we'll see, there's a lot more to the story. Sciatic nerve passes underneath the piriformis and then crosses over another group of muscles referred to as the deep hip rotators. It then continues along and dives underneath one of our hamstring muscles on the back of the leg. Just above the back of the knee, the sciatic nerve splits into 2 smaller nerves, and these continue down into the lower leg. In a nutshell, the sciatic nerve impacts many different parts of the body. There's a lot that can go wrong and lead to agitation of this important structure. Remember, the word sciatica isn't a specific diagnosis, but rather just a general description of symptoms. And often, this is where a lot of people, and even doctors, will stop asking the important questions. In the clinic, when we hear sciatica, it tells us what is affected, but it doesn't tell us what is affecting it. It's crucial we identify the source of the problem. That way, we can target it specifically instead of hurling medications, injections, or exercises at it, simply praying that something sticks. If any of this sounds familiar, sciatica is a safe bet. But what's causing it? To solve this case of whodunit, we can start from the top and work our way down, beginning at the spine. All of our nerves originate from the spine. If something is impeding or compressing the nerves as they exit, sciatica is going to result. This could be a disc-related issue, stiff or arthritic joints, or a tight muscle. A quick test you can do is to sit in a chair or lean your hips against the wall or something sturdy and perform some of the basic motions of the spine. These include flexion, extension, side bending to the left and to the right, and rotating to the left and to the right. Making our way down the leg, our next pit stop is at the infamous piriformis. Like I mentioned earlier, this muscle often gets blamed for causing sciatica, and rightfully so in some cases. Because the nerve passes right underneath it, if this muscle is overworked or guarded, it can put direct pressure on the sciatic nerve. And another fun fact, a small percentage of people, around 10%, have a variation in their sciatic nerve where it passes straight through the piriformis instead of under it, which could make sciatica more likely for that lucky 10% of people. A simple assessment you can perform yourself would be applying firm pressure right in the middle of your buttock area and seeing if this elicits your typical symptoms or if there is a lot of sensitivity there. You can also lay on your back and rotate only your hips or have a partner rotate your hips. What we're doing here is trying to determine if the rotation at the hips is contributing to the symptoms of sciatica. And we'll do this by isolating external and internal rotation of the hips, as well as combining those motions with other angles at the hip. If this is uncomfortable or sends any signals down the leg, this might be the source of your problem, or at least a contributor. One of the frustrating things about sciatica is that it is often driven by multiple problems rather than just a single factor. Case in point, let's look at the deep hip rotators. They are located adjacent to the piriformis and they perform the same motions at our hips. This means they too can irritate the sciatic nerve, either directly or indirectly, bringing additional compression or leaving the poor old piriformis framed for a crime it may not have committed. The last stop on our journey is the hamstrings, where the sciatic nerve passes right under the long head of the biceps femoris. The same rules apply here as with the piriformis. If the hamstrings are overworked, guarded, or tight for some reason, they could place undue pressure on the sciatic nerve and cause some symptoms radiating into the rest of the lower leg. And you're probably thinking, well, great. My problem could be coming from any of these places. This is true, but there are solutions. Doing a few diagnostic tests can help you determine where the source of the problem is. That's the first step. The second step is then addressing that area. What causes this problem in the first place? Commonly, it's a case of overload. Simply doing too much of a certain movement, like bending over improperly, an awkward motion, or trying to move something too heavy. In other situations, like the straw that breaks the camel's back, small instances of stress will finally add up to big symptoms without a major uh-oh moment. In both cases, the issue comes down to the level of mobility and stability that's supporting the spine and hips. Removing the pressure from the sciatic nerve involves improving your flexibility. Many videos will recommend only doing this. However, it really takes a dedication to increasing your strength in certain areas. This allows adequate support to the sciatic nerve and surrounding tissues. This is the only way to truly ensure the body can move in a way it is designed to. And the sooner you address it, the better. More often than not, this won't just disappear on its own. The nerve will continue to become increasingly more compressed and irritated over time. If you're interested in getting a handle on sciatica, check out some of our other videos on our channel, like this one, and get the ball rolling. See you next time.